This video is intended for educational purposes only. It is not intended to replace any recommendations or guidance from your healthcare providers. If you are searching for a particular topic, please use the index in the description below to quickly jump to the sections you are most interested in. Welcome to Las Vegas Bariatrics. I'm Dr. Santo, and I'll be reviewing essential exercise and nutrition information that you'll need to have knowledge of in order to be successful on your weight loss journey. This video is broken into two main sections: the pre-operation or pre-op diet and the post-operation or post-op diet. In this section, we will discuss everything you need to know about diet during the period of time before you have your surgery. Let's begin by talking about bariatric surgery from a philosophical standpoint. Your stomach size is going to be reduced from the size of a football to that of a large egg. Obviously, this reduces the amount of food that can be eaten at any given time. But what is more important is that the opportunity to extract nutrients from food will be drastically diminished. This highlights the importance of choosing the best foods to nourish your body adequately. As part of your new lifestyle, your relationship with food, the way that you use food, and the way that you interact with food at social gatherings all have to change in order to be successful. This can be a psychological challenge for patients and needs to be addressed as you move along your weight loss journey. Finding tactics that help you overcome the mental struggles associated with your current relationship with food is not easy and often requires trial and error. At Las Vegas Bariatrics, we strongly encourage you to consult a behaviorist for the best outcomes. It is important to understand what nutrients are in order to choose foods wisely. Nutrients are basically chemicals contained in food that sustain life. Without them, we would become nutritionally inadequate and eventually die. There are three main categories of nutrients. Macronutrients are the ones we need in larger quantities, micronutrients are the ones we need in lesser quantities, and water is the most indispensable nutrient of them all. Let's discuss the macronutrients in a bit more detail. Carbohydrates are separated into two categories. Simple carbohydrates are the monosaccharides, glucose, fructose, and galactose. These require no digestion and are rapidly absorbed into the bloodstream. For some individuals, particularly if a person has diabetes, these may present problems in regulating blood sugar. In contrast, complex carbohydrates are large, highly branched structures called polysaccharides, similar to the spider-looking graphic you see on the screen, that require considerable digestion and subsequently take longer to absorb into the bloodstream. In general, this tends to help minimize the fluctuations in blood sugar. In practical terms, it is better to ingest carbohydrates from sources like vegetables, legumes, and fruits because this maximizes the nutrients available for absorption. For all intents and purposes of our discussion, lipids are basically fats. Certain types of fats are an essential part of our diet and should not be eliminated. However, we do need to regulate our intake of saturated and trans fat because of the increased risk for dying prematurely from heart disease and cancer. Saturated fats should constitute no more than 10% of our daily intake, and trans fat should be kept as low as possible. It is far easier to ingest less trans fat these days because the FDA banned its use in commercial products in 2018. However, a significant source of trans fat is still available in our diet anytime we fry our foods. So French fries, fried chicken, donuts, fish fry, fried Twinkies, anything fried will introduce trans fat into that food item. Oils that are heated to a high temperature have a rearrangement of their structure that leads to the creation of trans fat that then gets absorbed into the food we are frying. So the bottom line is to avoid fried foods to keep your risk for disease low. Unlike carbohydrates and lipids, protein cannot be stored for later use in the human body. This means that we need to ingest foods containing high-quality protein on a regular basis to maintain adequate nutrition. Protein is made up of building blocks called amino acids. Just like a brick wall consisting of many bricks, proteins consist of many amino acids. There are 20 of these amino acids and 9 of them are essential, meaning that we cannot make them. We have to get them from food. By definition, a high-quality protein is one that contains all of the essential amino acids. As far as micronutrients are concerned, these are vitamins and minerals. The most important point I'd like to make here is that you should understand that you are signing yourself up for a bariatric prepared multivitamin every day for the rest of your life. This is a requirement and not optional. We'll discuss this in greater detail in the post-op diet section. Finally, water is the single best beverage you can consume to stay hydrated. The principle of nutrient density should ideally be at the forefront of every decision you make in terms of the types of food you select. To explain this concept, let's take a look at this picture showing two snack options. Snack option number one is the classic American snack, something sweet, something salty, and an ice cold soda to wash it all down. Snack option number two is more diverse with popcorn, blueberries, carrots, hummus, strawberries, yogurt, peanuts, and beef jerky. Volume-wise, you'll notice that snack option number one is less than snack option number two. Despite the size difference, the interesting part is that they are both equivalent in terms of their energy value. They are both 500 calories each. So what's different? Let's take a look at the top bar chart. This corresponds to option one. On the y-axis, we have the percent contribution to our daily need, and the x-axis corresponds to calories and nutrients. The first item to point out is the low amount of protein contained in this snack, less than 10%. The next item is the highly processed sugar content that reaches over 140% of our daily value needs just in one snack. The saturated fat is also far higher than the recommended 10% daily value. Lastly, option one has nearly nothing to offer in terms of vitamins and minerals aside from the magnesium, which is coming from the potato chips. Snack option one epitomizes what is referred to as empty calories. In contrast, the option 2 snack contains about 75% of our daily need for protein and about half of our daily need for sugar, which happens to be naturally occurring in the foods in this snack as opposed to the highly processed added carbohydrates. The saturated fat is slightly higher than desirable, but is coming mostly from plant sources which tend to be more neutral in terms of our risk for disease. More importantly are all the purple bars to the right of saturated fat. These are vitamins and minerals that help keep our bodies nourished. Snack option number 2 is what we refer to as nutrient dense. In other words, there are a good number of nutrients packed into a small amount of food. This is a snack where we can get a lot of bang for our buck. So nutrient density is about getting as many nutrients as possible in the very little amount of food that you'll be eating. Fiber is a type of carbohydrate that cannot be digested by the human gastrointestinal tract, but can be very useful in helping bariatric patients prevent or relieve constipation. There are two types: soluble fiber, which just means that it dissolves in water and is associated with the cholesterol lowering effect in blood, and insoluble fiber, which means that it does not dissolve in water and is associated with the softening and bulking of stool. It is the insoluble fiber that will have the most potent effect in keeping us regular. We recommend getting your fiber from vegetables, legumes, fruits, chia and flax seeds, etc. The Fiber One cereal pictured here has 17 grams of insoluble fiber in just 2/3 of a cup, so that's an easy way to help you meet the recommended 25 to 35 grams of fiber per day. Consider crushing the cereal and adding it to the liquid of your choice. Using Benefiber and Metamucil are also acceptable options. It is important to note that you'll want to avoid fiber for at least 5 weeks post-surgery to allow your stomach to heal properly. If you are experiencing constipation, make sure you are drinking 64 plus ounces of fluid because that is typically the primary cause. In addition, it is important to maintain an active lifestyle because regular exercise also helps us keep regular. As a bariatric patient, it is important to avoid sugar and keep your intake to less than 5 grams per serving to avoid dumping syndrome, which is a bad case of diarrhea and can lead to dehydration very quickly. We recommend the use of any of the variety of alternative sweeteners currently available. However, we caution you on the use of one category of alternative sweetener known as sugar alcohol. In the general population, sugar alcohols can induce diarrhea, which, again, is a threat to your hydration status. After having surgery, your new stomach may be more sensitive to the diarrhea effect of these sugar alcohols, so you'll want to try using them in very small quantities or just avoid them altogether. There are a few tips to help you be a savvy shopper. First, it's important to recognize that most sugar alcohol names generally end in OL, as you see in this list. Companies sometimes will list sugar alcohol as sugar alcohol on the nutrition facts panel, just like in the monk fruit sweetener. That's the red and white packaging you see in the picture. However, sometimes the proper chemical name is used both on the packaging as well as the nutrition facts panel, as you see in the blue and white packaging of the erythritol blend. So it's important to recognize the chemical name so you can identify if the product has sugar alcohol in it. Where things become a little tricky is with products that contain a blend of different alternative sweeteners, like in the stevia extract blend. That's the green and white packaging you see in the picture. Stevia in the raw does not have the diarrhea effect that sugar alcohols have. However, the key word on this packaging is blend. If we look at the ingredient list of this particular product, what we see is that the bulk of this product is erythritol or sugar alcohol, not stevia. It is important to note that the ingredients are listed by weight of predominance. In other words, the ingredient that contributes the most to that product is listed first, followed by lesser ingredients. So the take-home message is read your labels very carefully to avoid inducing a bad case of diarrhea. It is important to note that other alternative sweeteners such as Equals, Sweet and Low, Splenda, Stevia in the raw, etc. typically do not have the diarrhea-inducing effect that sugar alcohols have. The bariatric diet is very much protein-centric, so making sure that you consume high-quality protein sources is paramount. As far as prepackaged protein supplements are concerned, Las Vegas Bariatrics has you covered. You can purchase all of your required supplements through our online store or by calling the clinic and speaking to one of our bariatric coordinators. If you recall, a high-quality protein source is one that contains all of the 9 essential amino acids or building blocks of protein. Protein sources such as whey, casein, soy, and egg whites are ideal for helping you meet your daily protein goals. As a bariatric patient, it is important to keep track of the number of grams of protein you consume throughout the day. It's easy to do with prepackaged protein supplements, however, it becomes a little bit more challenging when it comes to actual food. One way is to use a standard reference like a deck of cards to gauge the correct portion size. That is, one portion of your meat, fish, or chicken should be about the size of a deck of cards. To determine the number of grams of protein, use a 1:7 ratio. That is, every ounce of animal protein will provide about 7 grams of actual protein. So a 3 to 4 ounce serving provides about 21 to 28 grams of protein. For plant proteins, use a ratio of about 4 to 5 grams per ounce eaten. One last note is that for those of you watching who are lactose intolerant, you should be aware that the premixed protein beverages contain lactose, and therefore you might experience associated signs and symptoms. The Nutrition Facts Panel is an important tool in helping you decide whether or not a food item you are interested in consuming fits within your nutrient density budget. There are 3 main points that I'd like you to remember from this slide. Number 1 is to always look at the serving size and the number of calories per serving. Manufacturers can manipulate the serving size to make their products appear healthier than they actually are. If the serving size is small but the calories are high, it is probably best to find an alternative food item. The second point is to make use of the percent daily value column. That's the purple shaded column you see in the Nutrition Facts panel. In order to make use of these data, you'll need to remember that 20% or greater is high for a particular nutrient, while 5% or less is considered low. These parameters can be considered good or bad depending upon the specific nutrient you are analyzing. The dark orange shaded rows represent nutrients that we should be limiting in our diet, while the light orange shaded rows are nutrients that we should try to incorporate more of. As an example, I noticed that there is a 20% daily value for added sugar. That's 10 grams of sugar per serving and is too high, considering that the recommended serving is 5 grams or less to avoid dumping syndrome, better known as a bad case of diarrhea that increases the risk of dehydration. As such, this is a product that should be avoided. The third point is to look at the ingredient list. As I mentioned earlier, the ingredients are listed by weight of predominance, so the ingredient that contributes the most to that product is going to be listed first and then progresses to lesser ingredients. If you see sugar listed in the first 5 ingredients, then you may want to consider finding an alternative to avoid dumping syndrome, as well as preventing excess calorie intake. The other aspect to consider is that the longer the ingredient list, the higher the likelihood that the product is less nutritious. It would be preferable to consume foods that are more in their whole or natural form as opposed to highly processed and highly refined items. It is noteworthy that some research studies suggest that consumption of highly processed food items can actually lead to the rewiring of neurons in the brain that promote addictive relationships with these types of foods. So if you want to minimize cravings, consider minimizing the consumption of highly processed foods. Let's move on to the pre-op diet or pre-surgery diet goals. The main goal is to reduce the size of the liver. Being overweight or obese can lead to an enlarged liver from accumulation of fat, also known as fatty liver. This takes up space in your body cavity and leaves less room for your surgeon to work. So the diet you'll see on the next slide is not designed to make your life miserable, but to reduce the size of the liver. In addition, the pre-op diet is designed to habituate you to being proactive about staying hydrated as well as staying focused on protein-rich foods to optimize the healing process. Lastly, this is also the time to begin a structured exercise program that will be incorporated into your new healthy lifestyle. We'll discuss this topic in more depth towards the end of this presentation. On the right side of this slide is the pre-op diet. You'll be replacing 2 of your current meals with 2 protein shakes that should conform to the following standards per shake consumed: more than 20 grams of protein per serving, less than 5 grams of sugar per serving, and totaling no more than about 150 to 200 calories per shake. You'll also be allotted 1 portion meal consisting of 3 to 4 ounces of a lean protein and 1 serving of a non-starchy vegetable, so no potatoes, corn, or peas. We'll discuss this more in the next slide. Staying hydrated is also a priority, and you'll need to drink 64 plus ounces of fluid, preferably water, every day. So you may be wondering, when do you begin this diet? This all depends upon your current BMI status. If you don't recall your BMI, you can use the chart on the left-hand side of the screen to do so. If your BMI is 40 or greater, that means you are in the orange boxes. You start this diet plan 2 weeks before surgery. If your BMI is 39 or less, that means you are in the dark purple shaded boxes. You start this diet plan 1 week before surgery. Here's another advantage of the pre-op diet in this picture. You'll be consuming your 2 protein shakes and 1 portion meal every day beginning 1 to 2 weeks before your surgery date. The column just to the right of this picture shows you the starchy foods you'll need to avoid, followed by 2 columns of non-starchy foods that you can eat. So if you didn't want the broccoli you see on the plate, you could exchange that out for chickpeas, for example. If the salmon doesn't appeal to you, then you could have chicken or meat instead. There is considerable flexibility, but you do want to make sure that your choice of protein is lean and that you are not consuming starchy food items. We do encourage you to eat the rainbow when it comes to your vegetables and fruits. All of the colors you see in these food items come from plant pigments, also known as phytochemicals, that have been shown through research to reduce our risk for heart disease and cancer. In some research studies, these phytochemicals have been shown to aid in weight loss and memory retention. Those are all great benefits of eating the rainbow when it comes to fruits and vegetables. On this slide are additional diet tips that you'll need to adhere to. All carbonated beverages, including sparkling water, need to be eliminated. After having surgery, the carbon dioxide dissolved in a liquid escapes once it hits the stomach and causes stretching of your new pouch, which can lead to discomfort and possibly pain. Caffeinated beverages also have to be eliminated due to caffeine causing you to urinate more frequently, which could lead to dehydration. It is perfectly fine to consume decaffeinated coffee or tea on the pre-op diet. On a final note, caffeine withdrawal can lead to unpleasant symptoms like headaches for some patients, which adds to the discomfort during the post-surgery recovery period. The take-home message is to minimize your discomfort level by eliminating these beverages as soon as possible. 24 hours before surgery, your surgeon will likely place you on a clear liquid diet. Some surgeons allow full liquids, but we'll assume clear liquids for this discussion. During this time, you cannot consume alcoholic, caffeinated, carbonated, sugary, or full-bodied beverages, which includes those 2 protein shakes you were consuming. Once midnight, before your surgery arrives, you cannot have anything at all. That includes water. If your surgeon wants you to continue your current medications and they are difficult to swallow, you can have a micro sip of water to help you take them. When your surgeon begins removing part of your stomach, any food residue present could escape and easily contaminate your body cavity or get trapped in the staple line. This makes it more challenging for your surgeon to complete the task at hand. In addition, food residue could be aspirated into the lung. Since anesthesia slows body functioning and renders a person unconscious, you won't be able to actively clear your lungs, which could result in an infection like pneumonia. For patients with diabetes, digestion may be slowed even more, which means that additional time is needed before surgery where nothing is consumed. The safest bet is to make sure your stomach is completely empty by following your surgeon's guidelines. Prior to surgery, we like to remind patients to make it easy on yourselves by filling your prescriptions ahead of time, so you have everything you need. It is also not a bad idea to purchase some antibacterial soap, like the one you see pictured, and lather your body during a shower to help further reduce the risk of infection. It is also critical that patients who smoke or vape quit at least 6 weeks before surgery. The over 3,000 carcinogenic substances can interfere with the healing process and interact with the anesthesia, complicating your recovery time. Not only that, smoking and nicotine are not part of your new healthy lifestyle. As a gentle reminder, you'll need to stop consuming all alcohol, carbonated, caffeinated, and sugary beverages. As far as other shopping reminders go, make sure that you have purchased all of the required protein and multivitamin supplements, including the liquid you'll use to dissolve any powdered products with. You may also wish to purchase a fiber-rich food item to avoid constipation. Just be sure to avoid consumption of fiber for at least 5 weeks post-surgery. One last note is to understand that some patients will experience taste preference changes. So that juicy steak that you once loved so much before surgery suddenly now tastes completely repulsive to you. This concludes the pre-op diet portion of this presentation. In this section of the webinar, we will discuss the post-surgery diet and everything you need to know to be successful. The main goal of the post-surgery diet is to ensure proper healing through optimized nutrition. This is accomplished through staying hydrated with fluids, focusing in on consumption of protein-rich foods, making use of your required bariatric supplements, and beginning a structured exercise program. Let's discuss the post-surgery diet nutrients of interest. It is first important to recall that using the principle of nutrient density in making the best food choices is a tactic that should be continued for the rest of your life to maximize nutritional adequacy. Please remember that we eat food, not individual nutrients, so getting the most bang for your buck out of the very little that you'll be eating is critical to your success. As far as macronutrients are concerned, the emphasis should be placed on consuming protein-rich foods first. It is important to recognize protein-rich foods will also contain fats and carbohydrates, and as such, aren't nutrients that you need to be overly concerned about. We'll discuss this more later on in this seminar. As far as micronutrients are concerned, other than making good food choices by using nutrient density as your guiding principle, you have signed yourself up for a bariatric prepared multivitamin every day for the rest of your life. That's a requirement because bariatric patients need to establish a baseline intake of micronutrients to prevent becoming malnourished. It is noteworthy that you cannot use a typical grocery store multivitamin as a substitute because they simply don't contain sufficient amounts of nutrients in the quantities you need and lack the bioavailability to maximize absorption. Unless your surgeon has instructed you otherwise, for the first 3 months after surgery, you only need to take the bariatric prepared multivitamin. Once you get your blood drawn and analyzed, your surgeon will let you know if you need to take additional nutrients based on what your lab results indicate. Lastly, as part of your required supplement packages, you'll be taking a probiotic to help maintain a healthy gastrointestinal tract. As a gentle reminder, Las Vegas Bariatrics has all of the highest quality supplements available for purchase that you need. Please contact your bariatric coordinator or visit our online store. Here are some important diet tips to follow. Firstly, we don't recommend the use of straws because that can lead to a large amount of fluid and air filling the stomach very quickly. This leads to stretching of the stomach, which can lead to discomfort and pain. If this happens during the early phases of healing, that may result in leakage of the staple line, which will lead to hospitalization. Second, you can chew sugar-free gum all day long, but you mustn't swallow the gum because it is too tough of a material for your stomach to handle during the early phases of healing. Thirdly, we highly recommend avoiding all carbonated beverages because the carbon dioxide that is dissolved in that liquid will release once it is ingested into the stomach and leads to stretching of the stomach. The end result is discomfort and pain. Once again, if this happens during the early phases of healing, it may result in hospitalization. Lastly, we cannot recommend alcoholic beverages because they do not fit within your nutrient density budget and help to promote dehydration. These beverages fall under the category of empty calories because all you are getting is 7 calories per gram of alcohol consumed and no micronutrients. In addition, your stomach may be more sensitive and thus accelerate the absorption of alcohol, which will lead to quicker intoxication. Some folks may view being a cheaper date beneficial. However, we still can't recommend alcoholic beverages. This slide shows an overview of the diet texture progression that you will be placed on after surgery. It's important to make note of the time frame for each diet stage and to not deviate from this plan. Shortening any of these diet stages could lead to hospitalization, slowed healing, and reduced weight loss results. Please consult with your surgeon if you have any questions about the timing. In the upcoming slides, we will take a deep dive into each of these diet stages. We will cover the priorities, fluid requirements, and protein needs, as well as how to properly identify foods with the correct texture for each diet stage. Stage 1 is clear liquids and begins in the recovery room. As soon as you are able to, you'll begin consuming liquids. The priorities during this stage are fluids, protein, and exercise. It is important that all consumed liquids are compliant with the clear liquid standard. What counts as a clear liquid? To determine this, take a flashlight and place it behind a translucent bottle with your questionable liquid, just like in the picture. If you can see the light shining through the fluid, then it passes the test for being a clear liquid. In this example, the beverage on the left passes, but the protein shake on the right does not. It is also important to recognize that foods like scrambled eggs, cottage cheese, avocado, and meats seem soft enough. However, the key word there is soft. Soft foods belong in the soft food diet stage. Foods that require any kind of chewing are not appropriate during this stage. As far as exercise is concerned, as soon as you are able to, you should begin with simple activities like walking. A weight training program will be an important part of your new lifestyle. However, for the first 4 to 6 weeks after surgery, you'll need to avoid lifting anything heavier than 10 pounds to avoid complications with the healing process. Staying hydrated will be challenging after surgery because you cannot consume large quantities of fluid at any given time. The first sign of dehydration is thirst. Therefore, you'll need to drink fluids even when you are not thirsty to meet your fluid requirements of 48 to 64 ounces every day. That's a lot of work and basically means that you'll be consuming about 1 to 2 ounces of fluid every 30 minutes throughout your waking hours. Water, ice chips, sugar-free popsicles, sugar-free gelatin, decaffeinated coffee, and decaffeinated tea can all be consumed to help you meet your goals. You may be considering some of the sugar-free beverages you see in this picture. For example, the many varieties of vitamin water or sugar-free Gatorade. However, these beverages are expensive and rarely contain any amount of precious protein. We recommend the protein water in lieu of these drinks. If you want to vary your beverage flavors, consider adding sugar-free Kool-Aid, Crystal Light, or sugar-free Torani syrups to your water. Finally, you may also wish to consider a variety of broths: bone, beef, chicken, or vegetable. When it comes to protein, reach for those protein-rich foods first, always. During the clear liquid stage, it is quite challenging to meet your protein needs of 40 to 60 grams per day because very few clear liquids have any appreciable amounts of protein. Our recommendation is to consume protein waters like Bariatric Advantage's Clearly Protein, which not only provides about 17 ounces of fluid, but also has 20 grams of protein. Consuming just 2 of these every day would provide you with the minimum grams of protein needed. The remaining balance could be achieved, for example, by consuming Liquicell. The packets you see in this picture provide 16 grams of protein that can be consumed either in their concentrated form or diluted in water. On day 2 after your surgery, you'll begin your required multivitamin. So yesterday, you just had surgery, and today is the day that you'll begin your bariatric prepared multivitamin every day for the rest of your life. The 2 major companies we recommend are Bariatric Advantage and Bariatric Fusion. A typical grocery store multivitamin, Kirkland Signature, Centrum, Flintstones, etc., simply do not have the levels of micronutrients needed to ensure an adequate baseline of intake. This is an area you can't afford to compromise on because it could lead to serious nutritional inadequacies and even hospitalization. One important note is that since everything you are consuming during clear liquids is in fluid form, your capsules need to be taken apart like in the picture, crushed if they are solid, or completely dissolved in your mouth prior to ingestion. We also recommend talking with your surgeon or pharmacist regarding any medications that you need to take to determine if they are able to be crushed or dissolved. The second stage is the full liquids diet, which lasts for 2 weeks. The priorities during this stage are fluids, protein, and exercise. What beverages count as a full liquid? Other than being opaque, if you are ever in doubt, you can put the liquid through the spoon test. Take a spoon and dip it into your questionable liquid, just like the ramekins with the pink protein shake in the pictures. If the liquid is pourable and leaves little residue behind, then it passes the test for being a full liquid. In the example with the Greek yogurt, the texture in the left picture does not pass the test. However, if it is thinned with skim milk, as in the picture to the right, it can pass as a full liquid. It should be noted that the texture should be free of chunks or particulates to be in compliance. As a gentle reminder, foods that seem soft enough, like scrambled eggs, avocados, meats, etc., are not appropriate for consumption during this diet stage. As far as beverages are concerned that help you meet your goal of 48 to 64 ounces of fluids every day, you can continue to enjoy any of the clear liquids you've been having. But now, you can add full liquids like protein shakes, skim milk, sugar-free almond milk, sugar-free soy milk, sugar-free macadamia milk, sugar-free coconut milk, 100% vegetable juice, etc. Since these beverages have an energy value to them, we recommend staying with a maximum portion size of a half a cup or 4 ounces per meal. That's the size of a standard light bulb. As far as protein goes, protein first, always. To help you meet your goal of 40 to 60 grams, you can have items like plain Greek yogurt, low-fat cottage cheese, cream of wheat, and cream of rice, as long as they are thinned with skim milk or water. Low-fat creamy soups are also an option. However, you'll have to filter out any chunks or particulates using a strainer, just like I did with the cream of potato soup you see in this picture. Protein shakes and protein water are great options. However, you can also get creative and develop your own high-protein beverages. For example, adding protein powder to the many variety of broths. The QR code on your screen will take you to my video showing you how to prepare a high-protein broth properly so it doesn't get lumpy, which would not be compliant with the full liquids diet. You could also make a high-protein fruit punch by using Crystal Light, sugar-free Kool-Aid, sugar-free Torani syrups, etc. Remember to always use a sugar alternative sweetener like stevia in the raw instead of refined sugar to help avoid dumping syndrome and empty calorie intake. The third stage is pureed foods, which lasts for 2 weeks. The priorities during this stage are fluids, protein, and exercise. The texture, consistency, and moisture should be equivalent to that of applesauce or pudding with no visible lumps and particles no bigger than cream of wheat, just like in the picture. If you are ever in doubt, you can put the food item through the spoon test. Take a spoon and dip it into your questionable food item. If you can make a mound and it retains its shape, then it passes the test for being pureed. The chicken in the picture on the left does not pass the test. However, if it is pureed with water, as in the picture just to the right, it can pass for texture, consistency, and moisture content. Since pureed foods have more texture to them during this stage, it is important to take pea-sized bites and chew food thoroughly. It is also important to practice mindful eating so that you are only focused on your food and what your body is telling you in terms of fullness. Watching TV, talking on the phone, using the iPad, writing that novel you've always wanted to write, etc., are all powerful distractions that will result in eating too much food. As far as fluids are concerned, you can continue to enjoy clear and full drinks to help you meet your 48 to 64 ounces. I also like patients to think outside the beverage and understand that we also get water from food items we eat. The higher the moisture content of a food, the more water is available for absorption. For example, in order to puree the sweet potato you see on the plate, I added water to achieve the correct consistency. So that's a source of water that also contributes to our fluid needs. As always, we recommend maximum portion sizes of a half a cup or 4 ounces per meal. That's the size of a standard light bulb. It is important to remember to always use a sugar alternative sweetener like stevia in the raw instead of refined sugar to help avoid dumping syndrome and empty calorie intake. When it comes to protein-rich foods first, always. Since many high-protein foods can be pureed, meeting 40 to 60 grams of protein every day should be easily attained. However, taking the time to puree foods may not always be practical. As an alternative, baby food is a great option. The only caveat is that most baby food does not contain protein, so reading the food label is important. These Gerber Mealtime for Baby options provide 7 to 8 grams of protein in 2.5 ounces, depending upon the flavor you choose. Protein shakes are certainly still a fantastic way to help you meet your protein goals when time is limited. During this stage, you can begin adding grains and starches like maltomeal, oatmeal, grits, mashed and sweet potatoes, and winter squash to your diet again. However, you should hear my voice in your head telling you, protein-rich foods first, always. It is also noteworthy that if prepared properly, oatmeal can be consumed as is because it complies with the pureed food's texture. The fourth stage is the soft foods diet, which lasts for 2 weeks. The priorities during this stage are fluids, protein, and exercise. What counts as soft food? Other than having a soft texture, soft foods are low in fiber, don't require a lot of chewing effort, and are easy to swallow. If you are ever in doubt, you can put the food item through the soft foods test. Take a fork and smash the questionable food item just like in these pictures. If you can easily make a mash out of the food item, then it passes the test for being a soft food. It is important to continue taking pea-sized bites, chewing food thoroughly, and practicing mindful eating with no distractions. The second we feel any kind of fullness, we should stop eating. Any clear or full beverages previously consumed continue to be acceptable. However, it is usually best to consume water to meet your 48 to 64 ounces of fluid. Just as we discussed earlier, the moisture content of foods also contributes to your fluid needs. As always, we recommend maximum portion sizes of a half a cup or 4 ounces per meal. That's the size of a standard light bulb. It is important to remember to always use a sugar alternative sweetener like stevia in the raw instead of refined sugar to help avoid dumping syndrome and empty calorie intake. Are you ready to say it with me? Protein first, always! The goal is 40 to 60 grams of protein every day. Just be sure to choose foods that are compliant with the soft foods texture. This slide provides more examples of food items that are compliant with the soft foods texture. Any canned or frozen fruits you consume should be in water with no syrup added. Vegetables should be cooked so that they comply with the soft foods texture. Any soft meats like ground beef should be lean to reduce the intake of saturated fat and overall calories. Finally, 8 weeks after surgery, you can begin to have solid foods again. The priorities remain the same for the rest of your life. Stay hydrated with plenty of fluids, focus on protein-rich foods first, and progressively advance your exercise program to achieve new levels of fitness. This is the point in your diet progression where you can add caffeinated beverages back into your fluid choices. However, we recommend limiting your intake to 1 cup per day because of the risk of dehydration from caffeine if too much is ingested. Energy drinks should never be consumed because of the exorbitant amount of caffeine. Also, avoid high-fat and high-sugar creamers. Should you decide to sweeten your beverages, use a sugar alternative sweetener like stevia in the raw instead of refined sugar to help avoid dumping syndrome and empty calorie intake. Protein first, always! The recommendation is 60 to 80 plus grams of protein every day. At first glance, this may seem like an overwhelming challenge to meet. However, our food supply is actually quite plentiful in protein, which makes it easy to meet these recommendations as long as we select foods with higher levels of protein. The examples in these pictures show you how you can eat a variety of foods throughout the day to help you achieve your protein goals. The 113 gram protein example is a vegetarian option, while the 92 gram example includes 2 protein shakes. The 90 gram example is a typical mixed diet of plant and animal sources. In the 10 gram protein example, you will get 60 grams of total protein if you had all of those food items in one day. It is noteworthy that all of these examples conform to the maximum portion size of a half a cup or 4 ounces per meal. That's the size of a standard light bulb. On a final note, all of the food items in these examples contain some varying levels of fats and carbohydrates, which are also necessary in maintaining nutritional adequacy. This highlights the importance of understanding that while the bariatric diet focuses on protein-rich foods, the reality is that when we eat a variety of foods, we are also getting nutrient diversity. In other words, it would be a major challenge to completely eliminate fats and carbohydrates from our diet. This assumes that you are following the guiding principle of nutrient density as we discussed earlier. The take-home message is to become knowledgeable about which foods are protein-rich, build your meals around those protein-rich foods, and don't worry so much about how much fat and carbohydrate you should be getting because they'll be there. At Las Vegas Bariatrics, we want you to be successful for the long term. Our most successful patients are utilizing the following tips. Number 1, consume 500 to 800 calories per day for as long as you can to maximize your weight loss, as well as helping you to maintain your goal weight for life. The maximum portion sizes of a half a cup or 4 ounces per meal keeps your calorie count within this optimal range. Number 2, a protein-rich foods first, always mentality. If you'd like to consume carbohydrates, then we recommend using the 3-2-1 rule. In practice, you would take 3 bites of your protein-rich food first, followed by 2 bites of your non-starchy vegetable, and conclude this round with 1 bite of your carbohydrate-rich food item. You would then continue this pattern of eating until you are satisfied. Number 3, emphasize consuming foods in their more whole or natural form as opposed to highly processed packaged goods. The more processed a food item is, the higher the likelihood that it is a less nutritious option. Number 4, limiting sugar intake to less than 5 grams of sugar per serving to avoid dumping syndrome and excess calorie intake. Number 5, focus on selecting foods that are nutrient dense as opposed to calorie dense to maximize your micronutrient intake and minimize unnecessary energy intake. Number 6, slowly consuming your fluids all day long to meet your 64 plus ounces every day. We recommend using the 30-minute rule around mealtime. This is where you stop drinking fluids 30 minutes prior to eating a protein-rich meal. You would then eat your meal with no consumption of beverages and wait 30 minutes until you commence drinking fluids again. This helps ensure that you have enough space in your small stomach to fit that protein-rich food. Number 7, since alcoholic beverages are considered empty calories and help to dehydrate you, we cannot recommend their consumption. Number 8, any food item that you try after you've had surgery will be a new food for you, and thus you need to make sure that you feel okay after having that item. It is not uncommon for bariatric patients to experience ill reactions to foods that once were well tolerated prior to surgery. The best practice is to take a few bites and see how your body responds so that you don't become uncomfortably ill. Number 9, it is important to practice mindful eating and minimize distractions so that you are tuned in to your body's signals of when you've had enough to eat without becoming uncomfortably full. We recommend practicing the 20-20-20 rule. This is where you chew your food thoroughly for at least 20 seconds prior to swallowing, followed by waiting for 20 seconds to make sure that everything feels okay. The final 20 of this rule refers to eating your meal over the course of 20 minutes. Why? It takes approximately 20 minutes for the signals from the stomach to reach the brain in order to provide updates regarding how much food was ingested. In practical terms, if an entire meal is eaten within a 5-minute window, for example, a person might have overeaten and not be able to recognize that point because the brain hasn't received that message yet. Number 10. Unequivocally, a structured exercise program should be incorporated into your daily routine to optimize your results and to help ensure lifelong success. The American College of Sports Medicine, or ACSM for short, has exercise guidelines for health-related fitness that are rooted in evidence-based research. It is important to keep in mind that these guidelines will not turn you into a track athlete or a bodybuilder. They are recommendations that help keep us healthy. There are 4 components of fitness that are important to address with an intentional exercise program. The first of which is body composition. The goal is to reduce the fat weight and increase the amount of muscle mass that a person carries. The second component of fitness is cardiovascular or aerobic exercise. This is the type of exercise that most people think of when they consider activities such as walking, running, cycling, swimming, skiing, doing house chores, gardening, etc. The ACSM recommends engaging in these kinds of activities at least 3 to 5 times per week at an intensity level that makes us feel uncomfortable and challenged. However, you should still be able to hold a conversation without falling over while performing the activity. The length of time recommended is anywhere between 20 to 60 minutes per exercise bout. The interesting aspect of this is that you can choose to either do this continuously or break it up throughout the day. For example, you might enjoy taking a brisk walk for 10 minutes in the morning, afternoon, and evening. As long as the intensity is sufficient each time you walk, you will get the same health benefits as if you had walked for 30 continuous minutes. This is great news because we can find ways throughout our day to make it more physically challenging for us that will contribute to our aerobic exercise goals. So instead of parking your car in a golden spot near the front door, you can park farther away and walk briskly to get into that building you're accessing, or taking the stairs instead of the escalator or elevator. How many times have you been on the Las Vegas Strip and waited to ride an automated people mover while the stairs were virtually free of people? It is also noteworthy that the stimulus to force our body to adapt to exercise is greatest when we perform activities with our legs because the muscles are much larger compared with our arms. The third component of fitness is muscular strength and endurance. The ACSM recommends engaging in some form of resistance training like weights or resistance bands at least 2 to 3 days per week, targeting each of the major muscle groups. The number of sets is anywhere between 1 to 4 and should be based on your current exercise routine. If you are not weight training, then 1 set, if you are consistent with doing 2 to 3 days per week at an intensity we'll talk about below, over the course of 2 to 3 weeks will result in significant increases in your muscular strength and endurance. The intensity or amount of weight or resistance you use should be such that you are only able to perform 8 to 12 repetitions. So if you complete 12 reps and are able to say to yourself, I could have done 30 of those, then the weight or resistance is too low. Gauging this will take a few sessions to determine your current abilities. The last component of fitness is flexibility. The ACSM recommends stretching activities at least 5 to 7 days per week, targeting all the major muscle groups with 1 to 4 sets. It is important to recognize that you should be stretching to a point of mild discomfort and not pain, and hold that stretch from anywhere between 6 to 30 seconds. As long as there is a stretch placed on the muscles, tendons, and ligaments, then it doesn't matter if you can reach to the floor as the lady in the picture is doing. You are still getting the same benefit. I'd like to take a few moments to remind you that Las Vegas Bariatrics is your source for all your supplement needs. Ordering is fast, easy, and secure via our online portals or by calling us over the phone. Please be sure that you have purchased the required supplement package through us in order to ensure that you have everything you need to help ensure nutritional adequacy on your weight loss journey. Staying up to date with what is going on in the bariatric world is easy if you join us on social media. Please use the keywords Las Vegas Bariatrics to find us on your favorite platform. Be on the lookout for our LVB Minutes, Success Story documentary films, LVB Kitchen, and infographics. The last important point to make is that at Las Vegas Bariatrics, we care about you and your success. On your weight loss journey, you will encounter good and challenging days. Sometimes it's easy to feel like you are all alone when you are having a tough day. However, I am here to tell you that you are not alone on this journey. You have an entire team behind you every step of the way. You have your surgeons, nurse practitioners, bariatric coordinators, and registered dietitian that are easily accessible to you. All you have to do is pick up the phone or email us, and we are ready to serve you. Thank you for making Las Vegas Bariatrics your premier choice for your weight loss goals.
If your health is important, we have the answer. Las Vegas Bariatrics.